Your back tooth pulses with every heartbeat, and biting sends pain through your skull. There is no dentist, anesthetic, antibiotic, or clean metal instrument waiting nearby. But doing nothing means hunger, sleepless nights, and perhaps an infection spreading deeper. So you probe the painful gap with a sliver of wood, searching for relief. That simple move is real. Neanderthal teeth preserve grooves consistent with repeated toothpicking. One newly studied molar suggests something far more frightening happened next. Around 60,000 years ago, someone may have deliberately opened a rotten tooth with stone. This was not modern dentistry hidden inside a cave. It was one desperate response to a problem that teeth themselves still record. To understand that response, first forget the myth of perfect prehistoric mouths. Neanderthals lacked soda and candy, so cavities appear uncommon in their known remains. Yet their teeth endured grit, hard food, heavy wear, cracks, gum disease, and occasional decay. A worn tooth could expose sensitive tissue even without a sugar-rich modern diet. When swelling began, every chew pressed the problem against bone and inflamed tissue. The first treatment was probably the tool almost anyone could make. A tough grass stem, splinter, or narrow wooden point could clear trapped fibers. It could also press and scrape an irritated space, briefly changing the pressure. At Cova Ferrada in Spain, a Neanderthal jaw carries distinctive grooves between teeth. Those grooves sit beside periodontal damage, supporting repeated attempts to soothe painful gums. This was not proof of medical theory, it was practical feedback from pain. If probing reduced pressure once, you would remember and try it again. Plants may have offered another layer, although the evidence demands caution. Hardened dental plaque traps microscopic food, smoke, bacteria, and plant material for millennia. At El Sidron, calculus from one Neanderthal with a dental abscess contained unusual clues. Researchers detected evidence compatible with plants known today for medicinal properties. That does not prove a prescribed painkiller, because plants enter mouths for many reasons. Still, the abscess and bitter plant traces make self-medication a serious interpretation. Now move east, into the cold Altai Mountains of southwestern Siberia. Chagyrskaya cave held tools, animal remains, and more than 70 Neanderthal fossils. Among them was one adult lower molar, now called Chagyrskaya 64. Its chewing surface contains a hollow reaching through the crown toward the pulp chamber. Ordinary where usually flattens a tooth, but this hollow had a different shape. Scans revealed demineralized dentine around it, the signature expected from severe caries. Microscopy also found controlled scratches and grooves along the hollow's inner walls. Researchers tested stone points on modern molars and compared the resulting marks. The closest explanation was deliberate rotating, drilling, or scraping of softened decay. The same ancient tooth also carries a separate groove consistent with toothpick use. Together, the traces suggest escalation. Probe the pain, then attack its source. Imagine the decision before the tool ever touches the tooth. Someone selects a narrow stone edge small enough to enter the damaged crown. The hand must rotate precisely while the jaw remains still. One slip could cut the cheek, crack enamel, or drive pain deeper. We cannot know whether the sufferer worked alone or trusted another person. We also cannot know whether cold water, plants, or pressure dulled the pain. The tooth records contact, not the voices, fear, or hands surrounding it. Removing rotten material might reduce pressure and clear debris from the cavity, but reaching the living pulp could cause an explosion of pain first. If the nerve later die, the throbbing might fade while infection remained possible. The researchers therefore call this mitigation, not a guaranteed cure. They also cannot prove the hollow's full depth was planned. Soft diseased dentine and an imperfect stone point may have enlarged it accidentally. Even with those limits, the action required diagnosis at its most basic level. The pain came from inside this tooth, and removing damaged material might help. Before this find, a scraped human tooth from Italy held the famous early record. That tooth was roughly 14,000 years old, astonishing but far younger. Chagyrskaya 64 pushes possible invasive dental care back tens of thousands of years. It does not reveal a Stone Age profession or a standard clinic. It reveals something more human: pain, experiment, memory, and the courage to intervene. The oldest dental story may begin not with expertise, but with refusing to endure helplessly.